You can't leave an animal constipated.
And if left unresolved?
You will eventually die. We can get colon ruptures, we can get all sorts, and I mean, that is just
dreadful.
Nothing like that ever needs to happen. We can definitely sort it out, and it can be a quick fix if you're on top of it.
A very warm welcome back to the Paws Effect Podcast. I'm your host, Dr. Cara, and I have Sister Kat back in the studio. Welcome.
Thank you very much. Thanks for having me.
Oh, we have had so many great discussions, which is why I keep pulling you back here.
It's all right. Yeah. Enjoy being here.
So let's go through some of the stuff we've discussed for the listeners who want to go back into the library of all the things.
Quite a few.
We've done weight and sort of the discussion on obesity in pets, and that went down very well. And I'm very grateful for that conversation because it's a toughie.
Yes, yeah.
We have done traveling with your pets in the car, and how to prepare for a journey. We have, it's not yet been released, but we've done one on anal glands, which I think probably, if anyone's pets or they know anyone whose animals suffer with the condition, will find that really informative.
Knows somebody. Yeah,
everyone knows somebody. And like, what else am I missing? What else have we spoken about?
Oh gosh,
so many things. But we are going to do the back end of our pets again. Sorry, I won't use any foul language on here, but we are going to have the conversation about constipation in pets because it's so common.
It is.
It's so common.
Incredibly common.
Yeah. So if you enjoy the podcast, please don't forget to subscribe. We are going to discuss why it happens, what it means, how to know that it is constipation. And I think maybe that's a good place for us to start because the obvious thing for owners to recognize is that they have a pet that is straining. You know where I'm going with this because straining does not always mean that their pets are constipated. I'm sure you've had these cases where on your notes it says, constipated animal coming in, and it's something completely different. Exactly. So let's go through the things that may cause a pet to strain. So what I'm talking about here is either they're going to the toilet to try and pass a wee, or they're going to try and pass a stool, and they are straining. What could be happening here?
Yeah. So the most common things that we see for when a pet is booked in for constipation that is not constipation is either the inability to urinate or it's actually diarrhea. So they have quite often either passed a lot of liquid and the owner hasn't seen anything, or it is actually a very irritated bowel that is making them sort of the sensation of needing to defecate, but there's not actually anything in there to come out.
Yeah.
But they will sit and squat and strain constantly. So it looks like they're constipated, not able to pass, but in actual fact, it's either irritated bowel or it's so liquid that it's already out and they didn't see anything. So those are quite often commonly what we see marked as constipation, but it's not legitimately constipation.
And let's talk about the bladder stuff because, I mean, you said we obviously have the females who may be showing sort of UTI signs in terms of strain, drip, or the males, typically male cats that become blocked.
Yeah.
And they also are pushing, straining.
Yeah. So with male cats, their urethras are so small that even a very small crystal from the bladder can block that urethra. And they obviously feel the need to urinate, and urine is not or not able to pass through the urethra. So they will squat continually. And because that urethra is blocked, the owners are not seeing little dribbles of urine because nothing's able to pass. So it looks like they're trying to pass a stool, where in actual fact they're trying to have a wee, but it's blocked, and that's an emergency. So,
absolutely, it needs to be seen.
If your animal is ever squatting continuously for whichever reason, it needs to be seen immediately so we can sort that out. So
from a clinical sign perspective, constipation is that. It's a sign. Yes. It's a sign that there is a problem. It is not generally something, we use the term constipation to communicate.
It's a symptom.
But it can be caused and it can be as a result of so many things.
Correct.
And we'll touch on some of those today. But I think let's first start off with some terminology. So what is constipation?
The inability to pass stool.
So we're talking hard stool, that sits in the colon.
Yeah, hard, dry, generally quite large as well.
Yeah. And I mean, a lot of, particularly South Africans, I mean, I know the podcast is listened to by people worldwide, but particularly South Africans, we have a lot of our pets that are outside, spend a lot of time outside, sometimes sleep outside,
sometimes
sometimes sleep inside, but they go outside often without the owners
Correct.
to defecate.
Yes.
And owners are not always aware of what they're passing.
Yes.
And so when we see these, they sometimes quite progress. They
Correct.
come in really quite bad.
Yeah. Now the dog is almost quite deathly ill after the fact, that they've been constipated for a couple of days. And unfortunately, as you say, no one's noticed because, the dogs are predominantly outside alone.
Yeah. And then, they're uncomfortable because like straining like that, it causes a huge amount of discomfort. But what are some of the other things that they might notice, especially if it is progressed? Like, are there other signs that may be part of this? Yeah,
so there'll definitely be a couple of signs. They are, in general, quite vague or sort of can be associated with other diseases as well. So generally, we can see vomiting. And that can literally be because food is going down, not able to go any further, so it comes back up the other way. So you can see vomiting, lethargy, inappetence, and just general ill-being, really not a happy camper. No. And then obviously when you are watching them, you'll see the straining and obviously abdominal discomfort as well. You might even get abdominal distension if it's quite severe because you'll get gas buildup in the bowel as well. That's also not able to go anywhere.
Yeah, I mean, I feel so sorry for these patients. And I mean, we'll touch on it. This is not, we do, like we said, we've got a whole library of actual discussions around things like renal failure and parvovirus and all those sort of things that may give the same kind of clinical signs.
Correct. Yeah.
We're not going to necessarily discuss those in details, but what are some of the causes that we can touch on that may be the reason why pets are becoming constipated?
So probably the most common cause that we see here, and also maybe a South African thing, is a lot of our dogs get fed bones, and bones is the number one cause of constipation. It quite literally turns the fecal matter into cement. And it's common in South Africa that a lot of pets get fed bones, so that's quite a frequent one. And then, basically what's causing constipation as well is a dehydration of that fecal matter, or there's not enough fluid. So lack of fluid intake, so not having access to water enough, super hot days in Durban here with us, and not drinking enough water. If dogs are being locked indoors or not having enough outside exposure to be able to go and pass stool, we get that dehydrated fecal matter in the colon because they're not going to relieve themselves.
And this is quite a common thing. I mean, we're not sort of necessarily distinguishing cats and dogs here, the general conversation about constipation, but this is a very common thing in our cats, particularly those with renal issues. But I mean, any disease process, as you made mention, anything that causes dehydration has the risk of causing a constipation. Correct. So anything that causes a fever, anything that causes your pet not to be drinking, consuming what they should, and we see that happen quite quickly, don't we?
Yes, yeah. So, a lot of the time we've got ill patients in hospital that are dehydrated for a completely different reason. As you say, it could be any number of diseases that they're not taking in enough water and they're dehydrated, or they're vomiting incessantly and dehydrating that way. And inevitably a day or so later in hospital and realizing that they're not passing stool either, and we're finding that they're constipated. So it's from a completely separate disease process that they've dehydrated themselves and are now constipated.
Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. So this fecal matter becomes sort of impacted, like you said, it becomes like a cement, essentially. Yeah. So you get resorption of water, particularly in the colon. That's what the role of the colon is, to try and dry it up so that they don't have sloppy stools.
Yes.
But you sometimes, there are disease processes, and we're not going to go and tackle megacolon in this podcast, but that could be a reason why your pet has sort of continuous bouts of constipation.
Correct. Yeah.
But when we talk about potential causes, there obviously are some disease processes that can affect the motility. And there we've spoken before, obviously, about obesity.
Yeah.
How is it and why is it that we find our obese animals are struggling with this condition?
Yeah. So, also throughout the intestine, we've got a lot of muscle action and contraction, to be able to move everything along as well.
Yeah.
And if you've got a lack of muscle contraction in the colon itself as well, which is quite prevalent in our obese and chubby patients. So they're also generally not able to pass stool effectively from a motility point of view.
Yeah.
Once again, this also goes back to that anal glands one that's not out yet, but even just the muscle tone from around the back end of a dog. Or a cat, if they're overweight, no muscle tone on the outside to, once again, effectively pass stool out.
So this is something that can, when they've had constipation, sort of set them up
for disaster.
For more bouts of it, right?
Yes, yeah.
So even when it's managed and it's cleared, it is something
it's going to happen again. Yeah.
Can happen again.
And, we also even then take it a step further as into like the diet that the patient is on. Like, is that what also correlates to them being overweight? Because a poor diet can also result in constipation if they don't have enough fiber in their diet as well. There's a lot of essential ingredients in good diets that are also part and parcel to healthy stool formation. So if we've got, a poor diet as well, that can relate to it as well.
Yeah. So when we are getting these pets on our table in our consult room, we're taking history, we're doing a clinical examination, but what are you feeling? How do you determine that this pet has got constipation?
Yeah. So probably in the exam room with the client, probably first off the bat would be doing an abdominal palpation. Probably going to be tense in the abdomen, but if you are able to feel further up into the abdomen, you can actually feel the constipation itself. You can feel the entire length of the colon, which is not normal. And it is rock solid, and quite often we're not even able to manipulate those fecal balls. Like, you can sort of squishing what feels like a rock inside this dog's abdomen or cat's abdomen. And that would probably be the first tell that we would also then want to move the patient through and do a rectal exam. And actually have a feel of what the feces feels like. Is it dry and crumbly, and sort of how much room we have to play with inside. I know that sounds dreadful, but also that also gives an indication. For example's sake, if a patient were to have broken their pelvis in the past, and the pelvis has healed at a funny angle, or it hasn't healed 100% in the normal shape, the rectal canal is smaller or different or changed, and we would possibly be able to feel that on a rectal examination as well, that we can feel that there are changes in space.
And absolutely, and in the same breath, we don't see a lot of uncastrated males, but we do also have that issue with our uncastrated males of having enlarged prostates, and that can also cause an enlargement and a narrowing, like you say, of that canal space that can lead to fecal matter becoming sort of impacted.
Yes. Yeah.
But I think, we go back to the obese or slightly, I'm using terminology that may offend my listeners, but just are slightly overweight patients. And you're saying sort of in terms of the pressures and the normal activity, there has to be the ability to sense stool in the colon. And in the same way, to be able to empty bladders properly. And we find that obviously these patients that are slightly overweight or obese have got a changed sensation.
Yes.
So, and then when we're talking about other causes of constipation, like we said, all the disease processes, but you made a good point of saying, have they had any previous accidents?
Trauma.
Is there any trauma? Yeah. They may not want to posture in order to go. And we see that quite a lot, don't we?
Yeah, so especially in our senior patients, we often get a lot of arthritic changes either in the pelvis itself, like in the hips, or even in the spine. And first and foremost, we also have a lot of nerve endings in those areas. Are the nerves not working as well as they used to? Or if you've got a lot of arthritic changes or an unstable spine, the physical posturing is going to be very uncomfortable. So they are choosing not to defecate rather than not having the ability, but sort of it's uncomfortable. They don't want to get down to that position. So they do tend to sort of hang on to it. Yeah. And unfortunately to their own detriment, because then hanging on to it obviously gets drier and harder and less likely to be able to come out, especially in a painful, uncomfortable dog.
Yeah. Yeah. And I mean, in terms of, like you said, the straining is one of those sort of vicious cycles where, the more they then have to posture and more uncomfortable, the less likely they are to want to.
Yeah.
So, yeah, it's so true. Pain relief for arthritic older senior patients can make a big difference. But on that subject, there are some drugs that we give for various disease processes that can actually result in constipation as sort of a side effect.
Yes, yeah. So one of the most common ones, and this is the case in humans as well, is morphine. Morphine is renowned for causing constipation. There are quite a few medications out there that you need to keep an eye on. And
so, part of the history taking and the information that you gather from the owners, what medication, if they are clients, is slightly different because we will have a list of those.
Yes.
But, what are you giving? Any supplements that you're giving? What medication? How often do you go out? So we gather a huge amount of information in order to best support not only sort of how serious this is and what might be causing it, but also how to manage things once you've resolved the problem.
Exactly. Yeah.
But let's go into that. So you've got this poor animal, cat or dog, and you can feel this huge amount of fecal material in the colon, and this now needs to be managed. How do you generally approach this? Is this something that you can just give the owners some medication and they go, or is this something that needs to be managed by admission?
So it would have to depend on the severity of the constipation. So what we would also likely do is an X-ray of the abdomen that helps us to determine also possibly a cause, if there's possibly a foreign body or something, or that we can actually see bone material in the feces as to what caused the constipation, how bad it is, how dry that fecal matter looks. As to whether it would be a mild constipation that we could possibly treat just with pet laxatives given to the owner to administer at home, monitor the situation, or if it was, they know what the cause was, the dog was out all day yesterday on the racetrack, hooliganisming all over the place and possibly a little bit dehydrated. So we know how to restore that and correct it quickly. If it is a severe constipation, we would generally admit into hospital, and we would also generally do all of it either under sedation or general anesthetic.
So what is the first thing that we do as we admit them? Do we place them on fluids?
Yeah, so first and foremost on fluids. And that can be intravenous fluids to sort of rectify the body's natural balance, but we may also want to even start before we expelling anything is to get fluids up the rectum as well, just to start softening that stool or to rehydrate the fecal balls, just to make the next step a little bit easier for ourselves. Some patients will tolerate that awake, in the sense that we're just putting a small feeding tube up the rectum and just introducing fluid into the area, generally a warm fluid, generally something with a lubricant base to it, just to start the process. But as I say, quite often these guys are uncomfortable, and for sort of manually expelling the rectum, we would do that under sedation of full general anesthetic, because that's way too uncomfortable for them to go through.
Yeah. So I suppose it's determined by how much fecal material is backed up, and that the X-ray helps you with that.
Yes.
And how often are you finding that it is relatively straightforward versus that they're needing a proper workup, including things like blood work and, try and get to the bottom of the...
Yeah, I'd say it's probably 50-50. A lot of the time it is a bone impaction or something silly like that. And then as I'd say, as many cases on the other hand, where it's something completely out of the blue that nobody seems to know what's happened with this animal as to why it's gotten constipated, and requires further investigation as to what's causing a dehydration or a lack of motility in the gut.
Yeah. So what you've already mentioned is they'll be admitted, they'll have an X-ray taken, they'll be put on IV fluids to try and hydrate them and to try and soften up that impaction.
Yeah.
what then happens in terms of the enema itself? Can you go through the process? Obviously, you say that they're sedated. They take us through what actually happens so the owners are aware of the full procedure.
Yeah. So pretty much we are using a tube that goes up a certain length of the colon. We do try and go as far as we're able to without causing any discomfort or any irritation to the bowel itself. And we are introducing a lubricated liquid of sorts, like liquid paraffin or something to that effect, that not only hydrates the fecal matter again, but lubricates the bowel to make it easier to expel. In some patients, we are able to, with abdominal palpation, start breaking down that fecal matter. We can sort of feel it in the colon, and we're able to start breaking down the fecal balls into bits and pieces that are easier to pass. That doesn't always happen straight off the bat. Some cases do require multiple enemas, multiple manipulations. Once again, that depends on the severity, on how dry, how hard, how bad, how much is in there. And then, quite frankly, it is then manually expelling the rectum. So we always double glove because your fingers are your tools to help move feces out the rectum.
And I mean, this doesn't cause a huge amount of trauma. There's a lot of, especially when they're relaxed.
Yeah.
This is not something that, that they're not going to necessarily tolerate this conscious, and that would be cruel to do that. But when they are sedated, everything's relaxed and there is no tissue damage.
No, sort of not from the enema and manual expel of the feces, but if the feces have been sitting there for quite some time and really hard and dry, and they've been putting pressure on it, we might have a little bit of intestinal damage from that side of things. It's not from
their bones, like you said.
Exactly. Yeah. So we have seen a lot of bowel irritation and small lacerations in the intestines from those bones moving through. So that can be expected, that there might be a little blood and irritation in the area, but it's sort of not from the enema procedure. It's from the impaction itself.
So for the listeners who have had a pet that has struggled with constipation, what are some of the things that they can do to mitigate the risk of this either recurring or saying, oh no, look, I've got a cat that's got renal failure, for example. I don't want them to get constipated. What are some of the things that they can be proactive about in order to avoid this happening?
Yeah. So a lot of it is monitoring. You've got to monitor your own patients at home, your own pets at home. So take, for example, the kidney cat. Make sure that they're getting enough liquid supplement. Are they drinking enough water? If they're not sort of consuming enough water, can we supplement it with wet food, just to make sure that there's a constant hydration, and sort of ask your vet on how to check for hydration status. So a couple of the things that we look at is gums. If gums are tacky to the touch, that can indicate dehydration. So those are easy things that you can monitor at home. Skin tenting. Some patients, skinnier patients, might look like the skin tenting is more severe. But sort of, go and have a chat with your vet, with your pet, and just sort of see what normal should look like, that when it's not normal, you're really on top of it, or you are able to monitor it closer. Go on poo patrol. So that's for dogs and cats, So as gross as it sounds, check your cat's poo, or like, oh gosh, my cat hasn't had a poo today yet. If you're on it within 24 hours, it's far better than you being on it in 48 to 30, or 36 to 48 hours. The sooner the better, the intervention, or the less complicated it's going to be to sort out.
Yeah.
Monitor the stool frequency, how hard, dry, or loose it is, because obviously an initial diarrhea can dehydrate a patient as well, then leading to a constipation. So, go on poo patrol.
And in terms of, you made mention of some of the diet. So, obviously with our renal patients, we probably prescribing them with a prescription renal diet, which will be adequate in terms of for that condition.
Correct.
But let's say for the non sort of disease process type prescription requirement, what are the kind of foods, or what is it about the food that may help this even in terms of the weight management diet. What is it that you're advising?
Yeah. So a good quality protein diet with a good fiber content in it, that's great for gut health and fecal quality, So, those are the kind of two paramount things that I would be concerned about or, wanting in a diet to keep that end happy and healthy.
And then there is something else that I find really interesting. And that's when we have a patient, for example, that is in hospital and they don't always, they've got their routine at home where they go to the toilet. Maybe they're very private about it.
Yep.
Like one of the things that we ask our guys to do is walk them. What is the benefit of providing some sort of exercise and movement in terms of encouraging pets to pass stools?
Yeah. So movement in itself increases gut motility. So we'll often find that even, in our little garden section, if we've just put an animal in the garden, they're not willing to defecate, we'll take them for a good long walk around, make them walk to get the gut motility going. But obviously it also, just to keep up with the muscle mass in the area, and a little bit of exercise also makes them a little bit thirsty, want to have a drink. So it's just sort of maintaining all of those that, a little couch potato or sitting in a cage, everything goes a little bit quiet and stagnant. So, getting up and moving is vital to keep everything going.
And is this some of the advice that you incorporate into post-discharge to owners that have got a pet that's predisposed to constipation? Do you encourage them to?
Absolutely, yeah. So depending on whatever you were in hospital for, whether it was just for the constipation or post-surgical constipation is the thing as well, once again correlating to the medication or the procedure itself. But yes, lots of short controlled exercise, so not rocking around. But, don't sort of take them out twice a day. That's not going to be sufficient, or we are going to get a backlog from that. So lots of little frequent exercises during the course of the day would be beneficial.
Yeah. And in terms of cats, because cats are very special, we love them. How do you manage it, particularly in a situation where cats are indoors? So from a litter tray perspective, how do you encourage the cats to go more frequently?
Yeah, multi-cat households are probably going to be the most common problem in that department, that cats are intimidated by others, so a lot of them do want a private spot or their litter tray. You get these litter trays that now have little hoods over them, if you will, or little housing, so that it is private for that cat to go in. Just touching on the litter tray side of things as well, a lot of constipations we've seen in cats is on rainy days or when we've had a rainy spell. A lot of people anticipate that their cats are outdoor cats and they only go to the bathroom outdoors. So these poor little guys are now sitting there for a week in Durban with rain, and they're not willing to go outside in the rain. So I've said it to a lot of my clients recently that I know your cat is predominantly an outdoor cat, but please have an indoor litter tray available for whatever reason if your cat decides not to go outside today, be it that the weather's bad, there's a pesky neighborhood cat that's making them uncomfortable, they've got to have options. So even if they are strictly outdoor cats, have a litter tray option somewhere that is safe and private for them to use. And especially in the bad weather, nobody wants to go and pop in the rain.
They're difficult.
Yes, yeah.
They're really difficult when it comes to that. No, I see it. They sit at the windowsill.
Yes, yeah.
Don't want to get their
vibrating.
paws too wet. So true. Now, the other thing that I have seen, and some questions I've actually had historically have been about pets that eat things like gravel. Obviously a bit like bones, it's going to cause that. How do you manage those sort of situations? Is it behavioral?
Yeah. So, eating gravel there's something going on. And either we need a behavior assessment or it's called pica, where animals are eating something that they shouldn't or eating random things, that there is something medically wrong with that patient. So pick and choose one to start, either a behavior consultation or a vet consultation, but it is going to be one or the other that there is something wrong, because a dog or a cat is not going to eat gravel willingly. sort of generally, people lean towards there being a deficiency of something, that they are then trying to find it and eating gravel, eating stones, licking bricks, anything the list goes on.
We've seen it all.
But there's definitely something wrong, and that needs attention. It's not funny. It's not a joke that your dog likes eating sand. Sand's another one.
Swallowing stones. We've seen those.
Yeah, there's something wrong that needs to be addressed, and that can be very dangerous. We've had dogs swallowing stones and they require surgery to get them out.
Yeah.
So,
even something as simple, the last case that I remember that comes to mind is that the fat from the braai was thrown on the gravel. Oh. And of course, this dog thought it was like a great idea to consume all
the
that.
stones. Yeah.
Yeah. So, this can happen obviously as an accident. People are not aware, which is, again, back to the importance of managing and trying to get to the cause of it, because then you can best manage it. If it's a case of changing behavioral and having behavioral modification and more walks or more stimulation or whatever it may be, or if it's a case of sort of saying this pet needs to be castrated, the prostate is large, and this is going to now start to impact. Or we need to do some bloods. We need to determine whether this is dehydration, the secondary thing of constipation, is related to a disease process or the high temperature or whatever it may be.
Yeah.
But definitely take-home message of this podcast is be proactive about it. Because
constipation is a symptom. It's not a thing on its own. It is happening because of something else.
Yeah.
So that needs to be investigated.
And if left unresolved?
Well, you will eventually die. Yeah. So, we can get colon ruptures. We can get all sorts. And that is just...
dreadful.
Nothing like that ever needs to happen. We can definitely sort it out. And it can be a quick fix if you're on top of it.
Yeah.
But you can't leave an animal constipated. It's
an advice to people who think that they can manage the constipation at home themselves.
Well, if you have been on top of it and you've realized that your pet is constipated right now, like it's only happened today, you are so on top of your pet, by all means, give it a little go with, you can get over-the-counter safe pet laxatives. But if it's not sort of fixed within the next sort of 12 hours, then I would definitely seek veterinary advice. Anything longer than that is too long. And, that needs to be addressed and checked out. And that's also if it's a once-off thing.
Yeah.
If you're having recurring issues, then you absolutely need veterinary intervention because there's something going on for this to keep happening.
Yeah. And also if they're in a position to be able to know that this is, in fact, back to our first part of our conversation, they can definitely say that this is constipation and that the straining is not due to something else.
Yeah.
So always very scary. When,
Rather ask.
Yeah, so true. Thank you for covering this. I
very
get
welcome.
you to do the grotty stuff, the rear end conversations. But hopefully it's been informative to those who need it.
Yes.
And definitely something to be quite proactive about, particularly, we've had some very hot days here and it can happen very quickly.
Exactly.
And, we say it can indicate that there is something far more serious going on. So it can be a life or death kind of decision.
Yep.
Thank you, Sister Karen.
Pleasure.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy, am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.